what is probably the most commonly prescribed drug that you may come across or you may deliver in practicing? It's going to be an antibiotic, yeah, for the most part, right? Like not generally, but yeah, for the most part. So we're still going to use the method. We start with the method, and the reason why we do the method is that it's a test taking strategy. So what is the method? For those of you that don't know, the method is my way of organizing my thought process. If I did not organize my thought process, would I become anxious? Yeah. But now we start with the last part of the question. Which of the following would be a contraindication for the use of tetracyclines in this patient? So again, now we're looking at what? We're looking at, what did I say about antibiotics? What did I say about drugs in general? What's the quick tip that we made, or what's the information that I said was important? It was going to be allergy, risk factors, contraindications, and what's the last one? Anybody remember? Yeah, education. Yeah, 100%. Contraindications, signs and symptoms, contraindications. These are the things that I'm going to look at. If I was to ask you about a drug, let's talk real life real quick. So we've got issues. If I say, all right, I'm going to give a patient tetracycline, I'm probably worried about a side effect, or I'm worried about a contraindication. I'm worried about dosage. If I do decide to do any type of math, it would be dosages. But in this situation, I'm not going to worry about it. And then pregnancy, and what did I say about pregnancy? How many people know about what I say about pregnancy? If it's in the answer choices, would I be concerned? Why are they asking that? Yeah, absolutely. Why are they asking that? Right? They gave it for a reason. So think about that. Is it always going to be right? Not necessarily. But at the same time, why did they put that in there? They put in there for a reason. So now I look at this and I look at which of the following would be a contraindication for the use of tetracyclines in this patient. So now I go back to the situation, and here we are using the method. I've got a 28-year-old female patient. So wait a minute. I gave you an age and I gave you a gender. Do you think that this was given for a reason? Yeah, 100%. Why would I give you an age? And do you think a 28-year-old potentially could be sexually active? Yes. Female patient, could they be pregnant? Yes. So now we have a patient that presents to the outpatient clinic with symptoms of a skin infection. The healthcare provider prescribes her a tetracycline antibiotic. These questions, they're brand new. These are ones that we made as a team at NCLEX High Yield, which would be following contraindication. So now I look at number 4 and I compare it to number 3. So type 1 diabetes with the tetracycline or hypercholesterolemia, probably none of the two. I wouldn't go with neither of them. So we were to cross off both. Now I'm down to 50-50, and now I'm comparing pregnancy with hypertension. Guess what I'm concerned about? Yeah, I'm concerned about pregnancy. There is one other thing that I would be concerned about, which is what? Sat for a photo. Good. But in this situation, again, why did they put pregnancy in there? Or why did we? We did it for a reason. Because I wanted you to see that tetracycline is a teratogen, right? And do you think you need to know all your teratogenic medications? Yeah. So let's name some off. Let's start with, we've got ACE inhibitors, good job. We've got valproic acid, methotrexate, good. See, these are all warfarin, phenytoin, doxycycline, lithium, good job. These are all medications that are going to be what? They're going to cause damage to the fetus. So yeah, I mean, y'all named off at least 6 ACEs and ARBs, good. So yeah, do you think you need to know them? Because again, what type of a question could it be? It's gonna be a freebie question or what we call the further teaching, further intervention. Good. Oh, well, I haven't had, and those of you that are writing notes down, write this down right now, right? This is how I would ask it. I haven't had my last menstrual cycle for 6 to 8 weeks. Let's just give it a range. And then, but I've high blood pressure. Or I've got an infection and I do methotrexate, or whatever the situation is, I've given you an indication that I may be pregnant, correct? Again, why did we put 28-year-old female? We did it for a reason, right? And why did I put pregnancy in the answer choices? I did it again. And retinol A, yeah, like isotretinoin is for what? What do we use it for? Especially in women that can become pregnant. We can use it for acne. Do you think it's commonly prescribed? It sure is. It sure is. So understanding these medications are teratogens and knowing them, 100%, you need to know them. So with that said, do you think we got this question right? Now I can't submit, but I'll scroll down and here is the rationale. Again, this is all brand new. This is stuff that nobody's created out there.